My name is Joan Mutiso. I'm the head of unit, laundry and tailoring unit. Basically, I perform the leadership role of the unit, including laundry and tailoring, whereby in laundry, we launder all the linen used by the patients in the hospital and return them back to the patients. And the tailoring section, we normally stitch all the linen, uniforms, bed sheets, pediatric items, theater items that are used within the hospital.
Depending on the program, there's a pre-wash, there's the main wash, there's the rinsing, then there's the hard extraction, then we offload. After offloading, there are those that will go direct to the drying machines, which is again was a program that takes between 45 minutes to 1 hour.
COVID-19 has brought a big challenge into our units because the hospital relies on us to make surgical masks that are being used by all the inpatients in the hospital. We've also been tasked with the duty of stitching body bags for all the COVID fatalities that happen in the hospital. For the body bag, it has been a challenge because this is one thing that we have never done before. So getting the materials, sitting down, drawing the patterns, getting the right stitches, getting the correct threads, supervising the tailors to ensure that it's up to par as what is needed to cover a body of COVID fatality, such that if the body is put inside that bag, there'll be no leakages. We've been given the mandate of stitching some of the PPEs, like the disposable aprons, something that we've never done before in the hospital. But all said and done, now we are able to stitch those things which we thought like would never be able to. And also we can also expand our capacity and stitch for other hospitals and be a revenue generating source for the hospital.
Kazi inaongezeka kwa sababu hospitali tunasomea kwa kila kona, the whole hospital. Sasa unakuta kuna wale kwa wote wanahitaji, lakini kuna special kama tuseme sasa kama mask, hiyo inahitajika lazima iende kwa 4,000. Na hiyo sio kitu tulikuwa tunazoea, ni kitu inatakana iwe usafi na iwe imetoka nyingi ikiende kutoshea hapo.
Our people are not used to the COVID that okay, we've been working simple. We protect ourselves, but in a simple way. When now you are told that you have to put on the full garment of the COVID, you think of your children, you think of your spouse, you think of your colleagues. We've had people who have been infected by COVID. After COVID, I think we've learned a lesson that there's need to protect ourselves.
I've had support from the top management. Whenever I require extra staff, I'm given casuals to assist me. Whenever I require extra machines to facilitate me in doing the necessary work that needs to be done for COVID, they've actually supported me and they bought those required items for those areas. I see my department moving into ISO certification for laundry services. Just like the way we are the biggest hospital in East and Central Africa, I would really love to get the hospital ISO certified as the first hospital laundry in East and Central Africa.